Who here has elderly family members who must make frequent visits to their family physician's office? Who has ever had a small child who is sick and in need of a doctor? Who personally has been sick and had to first wait in line to see the doctor, drive to a different location to the pharmacy, and wait in a long pharmacy line for your prescriptions, all the while feeling miserable? Personally, within the past 2 weeks, I had a doctor's visit where I had to wait to see the doctor, drive to Lima to go to the pharmacy at Walmart, where I was told that I have a 50-minute to 1 hour wait for 2 prescriptions. These issues are issues that Americans face every day, and they're ones that we don't like to deal with. Hi, my name is Alyssa Sneed. I'm a third-year pharmacy student here at Ohio Northern, and I propose to you a joint pharmacy and physician's office in Van Wert, Ohio. This combination will allow its patients to finish up at the physician's office while their prescriptions are en route to the pharmacy to begin the filling process before they ever even leave the physician's office. Not only does this combination add convenience, but safety as well. Prior authorizations with insurance will be resolved and refill requests approved in a much more timely manner due to close proximity of the pharmacy and physician's office. In addition, questions regarding safety issues can be answered more easily with this setup as opposed to separate offices. So by having this joint pharmacy and physician's office, not only will it help the elderly patients or the patients with young children that are sitting in the pharmacy screaming because they're in pain, but it will also help every person who ever has to go to the doctor or pharmacy by not only adding convenience to their lives, but making their lives more safely. Thank you. Are there any questions?
Does this kind of business exist anywhere already?
Yes, usually in bigger cities. Dr. Ferguson actually told us that he used to go to a clinic when he lived in Chicago that was this sort of a setup. It had several different offices actually. It even had like a dentist's office in it and just different kinds of things. Not quite as small as this, but it does exist in different areas, just not anywhere in the Van Wert area. We have about 4 different physicians' offices. One office has 6 physicians in it. A couple of the other ones just have 1 or 2. And then we have 3 pharmacies. I work at a CVS. There's also a Walmart pharmacy, and there's an independent pharmacy in Van Wert. So.
Do you have any estimate of savings in health or something else that will result from not letting people drive while they feel awful and such?
Like monetary savings or?
Monetary, non-monetary?
Not as much in that area. Really where this is going to help out is it's going to make the lives of the patients easier. I mean, obviously, if you feel crappy, you're not going to want to drive to a different location. It won't necessarily save you money-wise, more in the time aspect. I mean, if it's cold and rainy outside, people don't want to get out of their cars. That's why they usually use a drive-through, which, you know, would be incorporated into this as well for those patients who are bringing prescriptions from an outside place, like, you know, a dentist's office, things like that. Other than that, it's pretty much just helping the patient by, you know, cutting down on medication errors from the doctor's office, different things like that, and just making their lives easier by letting them stay in the same building for both services. So.
Are there existing places like this that you've seen?
Yes. Like I said, you know, Dr. Ferguson went to a place like this up in Chicago. A lot of the bigger cities have them just because they're easier to open places like that. But actually in the Van Wert area, it's getting to the point where it's hard to get in to see your family physician. It's, you know, a long wait at the pharmacy because we have so many scripts that we have to fill, different things like that. So, you know, adding this would be beneficial to the Van Wert area, not only for convenience, but because we are running out of those resources at a slow rate, but nonetheless we're running out. So.
Are you proposing an on-site pharmacy with a doctor's office?
Yes, what it would be within the building, you know, you would walk into the main building itself. Say on the right side you would have the physician's office. They would be kind of their own practice. And then if you would go into the left side, you would have the pharmacy. You know, it would have the general, you know, over-the-counter products, everything that a normal pharmacy would have with the pharmacy as well. But they would kind of have like a place to connect in the back. That way, you know, if, say, a nurse would have to go from the doctor's office to take a script over to the pharmacy, things like that. If the doctor would need to talk to the pharmacist, they could go back behind, but they would still be kind of like separate practices, but they would be just within the same building.
So you're going to have to convince some doctors to build a building to create a pharmacy to compete with CVS and Walmart and
Right.
whoever knows what else.
There are some doctors that, you have like the turf issue of, this is my area of the medical field. There are some doctors that won't even talk to pharmacists if they call in for, clarification on what they wanted. But there are other doctors that are very good with working with pharmacists and, helping figure things out because they know it benefits the patient. This would be beneficial to the patient because it would, cut down on mistakes from either side. If there needs to be communication between the pharmacist and the physician, it would really help with that. So there are a lot of doctors specifically that I know in the Van Wert area that would be willing to do something like this because they know it would benefit the patient.
I know some of the programs over in Lima, I believe, even have a CVS right there in the doctors' medical care clinics, those kind of things. So even some of the retail ones are willing to partner.
Right, and there's a lot of them that try to stay right next to like the doctor's offices and the hospitals. I know of a compounding pharmacy that's right across from St. Rita's because it makes it easier for the patient. And this would just add a little bit of extra convenience to it by having it right in the same building where you just walk from one side to the next and you don't have to go outside, you don't have to mess with any of that. And on top of that, while you're still paying for your physician's visit, your prescription will be on its way to the pharmacy. They can start filling it and possibly even have it completely ready by the time you get over to the pharmacy. So.
Do you have a doctor in mind as a likely candidate?
The place I was looking at, we have the physician's office that has the 6 different physicians in it. That one would be one that I think I would look at. I know that a lot of those physicians are very easy to work with. They know that they would do something like this. It would help them with business because they get a lot of like the elderly patients that, it's a pain for them to have to go from there over to the pharmacy. I know that would help them out a lot because that's really something that would draw in a lot of people is to have it, right there, easy access. You don't have to go all of these different places because that's one big concern we hear from a lot of people is, well, I had to wait over at the doctor's office and now I have to wait over here and you have to call the doctor's office and figure out what they wanted. Whereas if we didn't have to do all of that, it would make it a lot easier for them. So.
More questions? Thank you very much.
Thank you.